Dozens of doctors and nurses from across the UK have gathered here in London to march up to Downing Street, the Prime Minister's official residence. With them, they'll take a petition signed by more than 800,000 people calling for a 15% pay rise for health workers in England. In March, the government said all it could afford was a 1% increase. For many nurses, that would mean an extra few $100s a year. With inflation rising, that's effectively a pay cut. Following widespread criticism and an independent review of that decision, officials are now planning a 3% increase instead. But for many people here, that doesn't go far enough.
Because I've basically been living this situation from hospital to care home for the last 20 months. I know how hard the nurses have been working in the NHS.
We've lost 20% of our pay over the past decade. And after everything NHS workers have done in the pandemic, we believe we deserve better than this government has given us.
You're talking about low-paid workers that are providing a professional service for people in this country, putting their lives on the line, medically qualified and stuff like that. And to be fair, the wages are never livable.
The Royal College of Nursing, which represents the sector, says staff should get a 12.5% pay rise, as many have had to go above and beyond, especially during the fight against COVID-19. But the pandemic has also led to unprecedented economic damage, with a pay freeze in place across the rest of the public sector. For many people here, though, the past year or so has been the most challenging and exhausting of their professional lives. And there appears to be a lot of public support for the protesters here too. A nationwide campaign clapping for healthcare workers became a weekly occurrence last year, drawing in hundreds of thousands of people. There's also the threat of strike action to consider. Unions representing doctors and nurses say they're willing to move ahead with stronger measures if their demands aren't met. With the virus once again spreading rapidly across the UK, this is a political decision that could have far-reaching consequences, not just for those directly impacted, but for the millions of others in the country who rely on the public health service.